Hello, my name is Ying. I am a doctor. Welcome to your lecture series on familiar diseases. Today, we will be talking about depression. Today's lesson plan is here. We will talk a little bit about what depression is, why some people might become depressed, and what are the treatment options for depression. Depression is a psychiatric or mental health condition, and it affects a person's mood. It causes persistent feelings of sadness or loss in interest in things which people used to find interesting. Although depression has a formal definition in medicine, when we talk with other people in normal day-to-day conversations, it can mean a lot of different things. For example, it usually refers to a low state of mood in which a person is in. Sometimes people might say that they feel very depressed, even though really what they mean to feel is upset or perhaps a little bit sad. In medical terms, depression is only diagnosed when these feelings are present for longer than 2 weeks. Depression normally comes in waves. A person will experience multiple ups and downs where their mood is normal and when their mood falls and becomes low, resulting in symptoms of depression. During an episode of low mood, people will report feelings of sadness, of emptiness, and sometimes feeling hopeless. Occasionally, low mood may result in occasional outbursts of anger and feeling angry when people lose control of their emotions. Very often, people with depression may report feeling tired or having difficulty sleeping, even if they have no feelings of sadness or if they say that no feelings of hopelessness are felt. One important point to note is that in some people, none of the symptoms that were just mentioned may be present. They may not feel upset, they may not feel sad, they may instead feel tired or lethargic. Sometimes they may even say that they have headaches or stomach aches. In medicine, this is known as psychosomatic symptoms. This word comes from the ancient Greek word psycho for the mind and somatic for the body. Basically, what it means is that these symptoms that the body has, such as the headaches and the stomach aches, are actually caused by the mind and by mental health conditions. Depression affects quite a large percentage of the population. In 2016, a total of 3.4% of the population had a formal diagnosis of depression. In countries such as the US, this was about 4.81%. It was similar in Canada, with 3.97%, and in the UK, which was 4.12%. In Europe, the Nordic countries are known as the happiest countries in the world. However, Norway had a depression amount of about 3.72%, Sweden was 4.5%, and Finland was 4.83%. In Japan, this percentage was 3.3%, and Bhutan, which is known by many people to be the happiest place in the world, actually had a depression rate of 3.43%. Why do some people become depressed? The exact cause is not very well understood and is not known. Like other mental health conditions, it is believed to be a combination of both genetic factors and environmental factors. Genetic factors refers to a person's genes. So this means that anybody who has a family member with depression is more likely to develop depression than somebody else with no family history of depression or other mental health conditions. Environmental factors are also important, and these refer to a person's environment. For example, the family which they were brought up in, the people that they associate with, the country that they live in, and the type of society that they live in. For example, a big city or a small village. These are all environmental factors. However, it is widely agreed by experts that the most important factor is stress. Stress, again, is a very generic word which we use, and for different people, stress comes in different forms. For example, stress from work is something that most working adults will feel from time to time. However, not everybody who experiences work stress will develop depression. However, if the stress continues and persists over a long period of time, the likelihood that a person may develop depression is higher. In Japan, people know the term called black companies. Black companies. Black companies are companies which are usually famous for illegally long overtime working hours. In Japan, there is a significantly higher proportion of people with depression or who suffer nervous breakdowns in such black companies than in the general Japanese population. In recent times, there has also been an increase in the number of children diagnosed with depression and in child suicide, particularly in Asia, where the school systems are very strict and where high levels of performance nearing perfection are demanded of young children. People as young as primary school age, meaning about 7 years old, 8 years old, 9 years old, have been reported to show symptoms of depression. Bullying is also another form of stress which children might experience, and this is linked to depression as well. Social isolation is also another important stressful factor with a direct link to depression. Social isolation is important because humans are social creatures. We like to interact with other human beings. Unfortunately, more and more people are living in social isolation, and this is especially true for the elderly population. There are many elderly people who live on their own. They no longer work because they are retired, they have no families, and they have little to no friends. This is especially true in developed countries and nations such as Japan and in Singapore and in the US and in the UK. And increasingly, psychiatrists or mental health doctors are diagnosing more elderly patients with depression. Last but not least, a lack of sunlight in winter months is also a form of stress on the body. Do you find that sometimes in winter when it is cold, you feel a little bit upset or sad, or perhaps more tired or lethargic? So in Europe, people certainly report feeling sad during winter. This is a specific form of depression known as seasonal affective disorder, or SAD for short form. It occurs during the winter season when the sun rises very late and sets very early. There are a wide variety of methods which we can use to treat depression. In almost all kinds of patients, we normally use a combination of medical treatments and psychotherapy. Psychotherapy is commonly referred to in layman and everyday terms as just therapy. Psychotherapy is actually a very broad and generic term used to cover all the psychology-based therapies. The most well-known form is called cognitive-based therapy, which is CBT for short. Other forms of psychotherapies include group therapy, family and couples therapy, as well as problem-solving therapy, to name a few examples. Depending on the symptoms of the depression, some psychotherapies may be more effective than other forms. Medications are also widely used to treat depression. The most common form of medicine to treat depression, which is taken by patients, is called an SSRI. These medications affect the levels of chemicals in the brain, which researchers believe to be involved with depression. For specific causes of depression and low mood, such as SAD, there are now special types of light which are widely available for purchase. These lights emit light, a very bright sort of light, which mimics natural daylight. This means that when you shine that bright light on your face and on your body will actually believe that natural sunlight is hitting your body. This will change the chemical levels in your brain, which may relieve the symptoms of depression. Recently, very new and exciting treatments of depression and other mental health diseases are emerging. For example, scuba diving and virtual reality have been used to treat mental illnesses. Besides treating depression, preventing the development of low mood and other symptoms are also very important. While there is no fail-proof method of preventing depression, several strategies and good practices can help. These are all related to controlling stress. For example, if you are feeling down or upset or very stressed out at work or at school, engaging in activities that can help to boost your mood, such as exercising, is one method. You can practice yoga or mindfulness or meditation as well. As we talked about social isolation before, it is then very important to spend time with friends and family. This avoids social isolation and encourages a person to talk about their feelings and to share their difficulties. This is a form of self-prescribed talking therapy. Also, if you find that you have symptoms of depression, especially for an extended period of time, for about a week or 2 weeks or maybe even longer, it is important to see a doctor and seek treatment as soon as possible to prevent your symptoms of depression from worsening.